Guidelines and principles to rehab. This one is a very important one to remember. Rehab is not a 100-meter dash to the finish line. It is not a straight shot. Many times there are steps forward that are taken, and there are many times there are steps taken backwards. And that's when we have to get on track. We have to get our pain back under control. We have to use the exercises, the movements, and even sometimes some medication in people's cases to get things back under control, back to the point where we can get things moving better again and just getting the body kind of back to baseline, just so we can continue the healing process. So flare-ups do happen. That is a very common part of rehab. That's something we also try very hard to instill in our patients, and just remind them of sometimes things will feel a little bit worse, or things will feel a little bit different. If we can use the movements and the different things they're doing at home to control that, fantastic. And a lot of times too, if we're doing things to flare things up, there's some stuff that we need to change. And we will also reassess that at follow-up visits and make sure that we're changing that accordingly. Now, our body sometimes will throw us curveballs, and we need to be ready and make sure that we're kind of along the way with our patients to make sure those curveballs get taken care of. So remember, this is a process. This is not something that heals and happens overnight. This is not something that you can just sprint quickly to the finish line. This is usually a little bit more drawn out, and that's okay. And that's when people rush these things too, that's when re-injuries and bigger accidents and bigger issues tend to happen. And that's what we also try to remind them and avoid that from happening in the future.